Right now, as you watch this video, millions of people around the world are living a terrifying reality without even realizing it. They believe they sleep well, that loud snoring isn't a problem, that waking up tired is just part of adulthood. But there's something much more sinister happening during their nights, something science has called the brain's silent killer. I'm talking about silent snoring, a devastating form of sleep apnea that doesn't make enough noise to wake anyone, but is literally killing neurons with every interrupted breath. You might be thinking that if you don't snore loudly, if your partner has never complained about noise during the night, you're safe. This could be the most dangerous assumption you'll ever make. Researchers at the University of Sydney have discovered something that has completely changed our understanding of the brain damage caused by sleep apnea. They found that people with silent apnea, the type that barely produces audible sound, had a reduction of up to 15% in grey matter volume in critical brain regions responsible for memory, decision-making, and emotional control. To give you an idea of what this means, it's as if your brain is aging 10 years faster than it should, and this is happening night after night, month after month, while you think you're resting. Silent snoring is like a thief in the middle of the night. It enters your home silently without breaking windows, without setting off alarms, but it steals what's most precious to you, your brain capacity, your memory, your concentration, your ability to be happy and make good decisions. With each silent pause in breathing, which can last up to 40 seconds, your brain goes into absolute emergency mode. Oxygen levels plummet, neurons begin to die, and your body releases a cascade of stress hormones that bombard every cell in your nervous system. But here's the worst part. You may have been suffering from this for years and attributing the symptoms to other causes. That brain fog you feel during the day, the difficulty remembering where you left, your keys, the unexplained irritability, the feeling that your mind doesn't work as it used to, that fatigue that even coffee can't combat. You may be thinking it's age, work, stress, or even the onset of depression, when in fact your brain is being deprived of oxygen every night by a condition you don't even know you have. The tragedy of silent snoring is that it goes unnoticed by the very people who need help the most. International studies show that 80% of people with obstructive sleep apnea are unaware of their condition, and of those 40% suffer from the silent version. This means millions of people are walking around with their brains progressively damaged, thinking they just need more willpower to concentrate better or more discipline to wake up refreshed. Imagine a person working in a company who has always been recognized for her ability to solve complex problems and her exceptional memory. Over the years, she began to notice that she needed to read emails 3 times to fully understand their content, that she forgot important appointments even when she wrote them down, and that her patience with colleagues and family was wearing thin. She sought medical help, thinking she might be depressed, underwent tests for vitamin deficiencies, and even considered that she might be developing some form of early-onset dementia. It was only when a sleep specialist suggested a polysomnography that she discovered the terrible truth. Her oxygen saturation had been plummeting to 60% dozens of times per hour every night for over a decade. Her brain was being silently asphyxiated while she slept, and each micro-awakening it caused was so brief that she didn't even remember it in the morning. What makes silent snoring so devastating to the brain is precisely its stealthy nature. When someone snores loudly, family members complain, neighbors are disturbed, and the person seeks treatment. But when respiratory interruptions occur quietly, the brain continues to be bombarded by repetitive cycles of hypoxia without anyone noticing. It's as if you're being slowly poisoned dose by dose, with no obvious immediate symptoms, but devastating cumulative effects. If you've made it this far and something inside you is whispering that maybe, just maybe, this might have something to do with how you've been feeling, I want to invite you on a journey of discovery that could literally save your brain and transform your life. This channel was created specifically for people like you who suspect something isn't right with their sleep but don't know where to begin. We're not here to just scare you with statistics. We're here to offer real hope, practical solutions, and the knowledge you need to reclaim not just your nights, but your full cognitive capacity. By subscribing to this channel and activating the notification bell, you're taking the first step toward protecting your brain from damage that could be irreversible if ignored for much longer. Each video we publish is carefully researched to provide not only the most up-to-date information on sleep apnea, but also proven strategies that real people have used to regain their mental clarity, energy, and ability to live fully. You're not alone on this journey, and the sooner we act, the greater your chance of reversing the damage and preventing further damage. Leave a comment right now telling me if you've been experiencing that brain fog during the day, if you've been waking up feeling like you haven't gotten enough rest, or if anyone has ever commented on a change in your breathing pattern during sleep. Your comment might be exactly what someone else needed to understand, that they're not imagining things, and that there's a medical explanation for what they're feeling. Now let's dive deep into what's really happening in your brain when silent snoring takes over your nights, and you'll discover why every minute left untreated could be costing you years of future mental capacity. To understand what silent snoring does to your brain, we first need to understand that your nervous system treats oxygen deprivation as a life or death emergency, because that's exactly what it is. When you stop breathing during sleep, even silently, a series of catastrophic chemical reactions begins to occur within seconds. First, your blood oxygen levels plummet, and your brain, which consumes 20% of all the oxygen you breathe, immediately begins to go into biological panic. In this state of emergency, your brain releases an avalanche of norepinephrine, cortisol, and other stress hormones that make your heart race, your blood pressure rise, and your blood vessels constrict. It's like someone yelling fire in a room full of people, but it's happening inside your skull between 50 and 200 times a night every night. Your brain never gets a chance to enter the deep stages of sleep that are essential for clearing toxins, consolidating memories, and regenerating neurons. But here's the scariest part. Recent research using functional magnetic resonance imaging fMRI has found that silent snoring causes micro-injuries to the brain's white matter, the structures that connect different brain regions and allow them to communicate with each other. It's as if the roads connecting different cities in your brain are gradually being destroyed, making it increasingly difficult for information to flow from one area to another. Imagine a person who for years prided herself on her ability to perform rapid mental calculations and solve complex logical problems. Slowly, she began to notice that mathematical operations she once performed in her head now required pen and paper, that projects she used to complete in a few hours now took days, and that complex conversations became mentally exhausting. She attributed this to natural aging until she discovered that her silent respiratory arrests were causing cerebral microinfarcts, small areas of brain tissue that literally died from lack of oxygen. "It's like I'm losing pieces of myself every night," she described after her diagnosis, "and I didn't even know it was happening." The hippocampus, your brain's memory center, is particularly vulnerable to the effects of silent snoring. This seahorse-shaped structure, responsible for transforming experiences into lasting memories, requires a constant supply of oxygen to function properly. When this supply is repeatedly disrupted, hippocampal cells begin to die in an irreversible process. This is why people with untreated sleep apnea often develop memory problems that resemble the early stages of dementia. Longitudinal studies following patients for decades have discovered something terrifying. People with untreated obstructive sleep apnea are 50% more likely to develop Alzheimer's or other forms of dementia compared to people who sleep normally. Silent snoring isn't just a nighttime inconvenience, it's a modifiable risk factor for cognitive decline that can determine whether you grow old with your mind intact or gradually lose the ability to recognize loved ones. But the consequences don't stop there. The prefrontal cortex, the area of the brain responsible for judgment, impulse control, and decision-making, also suffers significant damage. This explains why so many people with silent snoring report personality changes, increased irritability, and difficulty controlling emotional reactions. It's as if your brain's brakes are gradually being worn away, leaving you less able to think before acting or remain calm in stressful situations. Chronic oxygen deprivation caused by silent snoring also interferes with the production of essential neurotransmitters like serotonin, dopamine, and GABA. These are the chemicals responsible for your sense of well-being, motivation, and ability to relax. When their production is compromised, it's no surprise that so many people with sleep apnea develop symptoms that resemble depression or anxiety, but are actually direct consequences of nocturnal cerebral suffocation. If you recognize yourself in these descriptions, I need you to understand something very important. You're not imagining these symptoms. You're not going crazy. And it's definitely not just a matter of age or lack of willpower. Your symptoms have a real, treatable physiological cause. Thousands of people around the world have recovered their full cognitive function after receiving appropriate treatment for sleep apnea, even after years or decades of suffering from the effects of silent snoring. I want to pause here to ask something very personal. Have you ever found yourself trying to remember a simple word in the middle of a conversation, feeling like it's on the tip of your tongue, but you just can't seem to access it? Or perhaps you've noticed that you need to reread entire paragraphs because your mind simply didn't process the information the first time. If you're feeling like your mind isn't as sharp as it used to be, please comment below. My mind doesn't work like it used to. You don't have to go into detail if you don't want to, but I want you to know that hundreds of people watching this video are probably feeling exactly the same, and together we can break the silence about this condition that affects so many people but is rarely discussed openly. Now let's talk about something that may sound contradictory, but is absolutely crucial. Many people with silent snoring believe they sleep well simply because they don't wake up completely during respiratory pauses. They can sleep 8, 9, even 10 hours a night and still wake up completely exhausted. This happens because what counts for sleep quality is not just the number of hours you spend in bed, but the quality of the sleep architecture you achieve. Human sleep is composed of different stages, each with specific functions for brain maintenance. REM sleep is when emotional and creative memory consolidation occurs, while slow-wave sleep is responsible for clearing brain toxins and consolidating declarative memory. When you snore silently, your brain never manages to stay in any of these stages long enough for them to fulfill their restorative functions. It's like trying to build a house while being constantly interrupted every few minutes. You never manage to complete any step properly. During respiratory pauses, even silent ones, your brain produces what scientists call microarousals, very brief episodes of brain activity that jolt you out of the deep stages of sleep, but are so brief that you don't remember them in the morning. These microarousals can happen hundreds of times a night, completely fragmenting your sleep without you even realizing it. This is why you can sleep for many hours and still wake up feeling as if you've been awake all night. Imagine a person who had always been known for her ability to work long hours while maintaining high productivity and creativity. Gradually, she began to notice that after lunch she felt an overwhelming drowsiness that made it impossible to concentrate, that long meetings became a challenge to keep her eyes open, and that creative projects that once flowed naturally now seemed to require Herculean effort. She tried various strategies, changing her diet, starting to exercise, taking supplements, and even considering a career change, believing she no longer had a passion for her work. It was only when she underwent a sleep study that she discovered that despite sleeping 9 hours a night, she was experiencing more than 300 micro-awakenings, meaning her brain was interrupted every 2 minutes throughout the night. It was like discovering I'd been sleep-deprived for years without knowing it, she recounted after her diagnosis. The glymphatic system, only recently discovered by neuroscience, is another critical victim of silent snoring. This system functions as your brain's housekeeping service, removing toxins and malformed proteins that accumulate during the day, including the amyloid plaques associated with Alzheimer's. The glymphatic system only functions properly during the deepest stages of sleep, when brain cells literally shrink to allow cerebrospinal fluid to flow more freely through the spaces between neurons. When silent snoring prevents you from reaching these deep stages of sleep, your glymphatic system can't perform its nightly cleaning. It's as if your house cleaning service never gets the job done because you keep coming home and interrupting the process. Over time, toxins begin to accumulate in your brain, contributing to chronic inflammation, neuronal dysfunction, and possibly accelerating the development of neurodegenerative diseases. Researchers at the University of Rochester found that a single night of fragmented sleep can reduce the efficiency of the glymphatic system by up to 60%. Now imagine what happens when this happens night after night for years or decades. It's a recipe for neurological disaster that may explain why so many people develop seemingly inexplicable cognitive problems as they age. The good news is that studies have shown that the glymphatic system can recover remarkably when quality sleep is restored. People who receive effective treatment for sleep apnea often report improvements in mental clarity, memory, and overall cognitive function within weeks or months. It's as if the brain has an impressive ability to heal itself when finally given the right conditions to do so. Let's now discuss the warning signs your body may be sending you to indicate that silent snoring is damaging your brain. Many of these signs are subtle and easily confused with other conditions, but when viewed together, they paint a clear picture of chronic oxygen deprivation to the brain. The first sign is that feeling of mental fog that never seems to completely disappear even after a good night's sleep. You may feel like you're thinking through cotton wool, with thoughts that seem slow and unclear. Tasks you once performed automatically now require conscious effort, and you may find yourself checking and rechecking simple tasks because you no longer trust your ability to do things right the first time. Changes in mood and personality are another critical sign. You may notice that you're more irritable than usual, losing your temper with family and colleagues over things that didn't previously bother you. Some describe a feeling of being emotionally dull, as if the colors of life have lost some of their luster. This happens because the brain regions responsible for emotional regulation are being affected by chronic oxygen deprivation. Problems with working memory, the ability to hold information in your mind while working on it, are particularly common. You may find yourself rereading paragraphs because you haven't processed the information, forgetting what you were going to say mid-sentence, or losing track of what you're thinking during conversations. It's as if your mental processing capacity has been reduced, forcing you to work more slowly and with more effort to achieve the same results. Excessive daytime sleepiness is another crucial indicator, but it's not just about dozing off during the day. It's more about a constant feeling of mental fatigue, as if your brain can never fully wake up. You may feel drowsy in situations where you should be alert, such as during important meetings or while driving, which can be extremely dangerous. Many people also report changes in their decision-making ability. Decisions that were once made quickly now seem overwhelming, require more time, and cause more anxiety. This is because the prefrontal cortex, our executive command center, is functioning at reduced capacity due to chronic oxygen deprivation. If you're finding this information helpful and recognizing some of these symptoms in yourself, please comment below. This helps me understand how many people are truly affected by these issues and motivates me to continue creating content that can literally save lives and minds. It's important to understand that silent snoring doesn't happen in a vacuum. There are specific factors that significantly increase your risk of developing it. The anatomy of the upper airway plays a crucial role. People with a proportionally large tongue for their mouth size, enlarged tonsils, an elongated soft palate, or a retracted chin are more likely to develop respiratory obstructions during sleep. But here's the insidious part. These anatomical features can cause severe apnea without necessarily producing the loud snoring that would normally alert the person and their family to the problem. Weight gain is another critical factor, but not in the way many people imagine. You don't need to be significantly overweight to develop silent snoring. Even small increases in body weight can deposit fat around the neck and throat structures, narrowing the airways enough to cause intermittent obstructions during sleep. Studies show that a mere 10% weight gain can make sleep apnea 6 times more likely to develop. Age is a factor that deserves special attention because the muscles that keep the airways open naturally lose tone over time. This means that people who have never had breathing problems during sleep may develop silent snoring as they age, especially if other risk factors are present. It's one reason why cognitive changes we attribute to normal aging may actually be the result of undiagnosed sleep apnea. Certain medications, particularly muscle relaxant sedatives and some antidepressants, can overly relax the muscles in your airways, increasing the risk of airway obstruction during sleep. If you've started taking a new medication and noticed changes in your sleep quality or daytime mental clarity, it's worth discussing this possibility with your doctor. Alcohol, even in moderate amounts, has a similar effect by relaxing the muscles in the airways. Many people find that their respiratory pauses become more frequent and prolonged on nights they consume alcohol, even if it's just a glass of wine with dinner. Timing also matters. Alcohol consumed within 3 hours of bedtime is more likely to affect breathing during sleep. Imagine a person who had always had seemingly normal sleep until her early 40s, when she began noticing subtle but disturbing changes in her mental capacity. She could no longer multitask, as she once did, had trouble remembering the names of people she'd known for years, and began experiencing embarrassing memory lapses during work presentations. She attributed these changes to stress and middle age until she discovered that slight weight gain combined with the natural age-related relaxation of muscles had created the perfect scenario for silent, obstructive sleep apnea. I thought I was aging prematurely, but actually my brain was being systematically deprived of oxygen every night, she shared after beginning treatment and regaining her previous cognitive ability. Sleeping position can also significantly influence the severity of silent snoring. Sleeping on your back allows gravity to pull the tongue and soft palate backward, further narrowing an already compromised airway. Many people find that their symptoms are worse when sleeping on their back and improve when sleeping on their side, but this isn't always enough to completely resolve the problem if the underlying anatomy predisposes to obstruction. Medical conditions such as hypothyroidism, diabetes, and hypertension are often associated with sleep apnea, creating a vicious cycle where one condition worsens the other. Hypothyroidism, for example, can cause swelling of the tissues surrounding the airways, while sleep apnea can worsen diabetes control by affecting hormone regulation and increasing insulin resistance. What makes diagnosing silent snoring particularly challenging is that many people and even healthcare professionals associate sleep apnea exclusively with loud, obvious snoring. A person may visit multiple doctors complaining of fatigue, memory problems, and mood swings, and never be questioned about their sleep quality simply because they don't snore loudly enough to attract attention. Now I'm going to share with you the long-term consequences of untreated silent snoring that go far beyond the cognitive symptoms we've discussed. What many people don't realize is that sleep apnea, even the silent version, is an independent risk factor for a wide range of serious health problems that can significantly shorten life expectancy. The cardiovascular system is one of the most affected by silent obstructive apnea. Each episode of respiratory arrest causes an acute overload on the heart, which has to work harder to pump oxygenated blood to the brain and other vital organs. Over time, this leads to the development of treatment-resistant hypertension, cardiac arrhythmias, and a significantly increased risk of myocardial infarction and stroke. Long-term studies following thousands of patients have found that people with untreated sleep apnea are 3 times more likely to have a stroke and twice as likely to have a heart attack compared to people who sleep normally. Even more alarming is that these risks increase progressively with the severity and duration of untreated apnea, meaning that each additional month without treatment increases the risk of a cardiovascular catastrophe. The endocrine system also suffers substantial damage from silent snoring. Sleep fragmentation interferes with the production and regulation of several critical hormones, including insulin, cortisol, growth hormone, and leptin. This hormonal dysregulation not only contributes to weight gain and the development of type 2 diabetes, but also affects your ability to cope with stress, recover from exercise, and maintain a stable mood. Insulin resistance is particularly concerning because it creates a vicious cycle with sleep apnea. Apnea worsens glycemic control, which leads to weight gain, which in turn worsens the apnea. Many patients find they cannot adequately control their diabetes until the underlying sleep apnea is treated regardless of how closely they adhere to diet and medication. Imagine a person who developed type 2 diabetes and, despite rigorously following all medical recommendations, exercising regularly, and taking medications as prescribed, couldn't maintain stable blood sugar levels. Her doctors increased dosages, changed medications, and suggested different dietary approaches, but nothing seemed to work. It wasn't until she underwent a sleep study and discovered she had severe but silent obstructive sleep apnea that everything clicked. After starting CPAP therapy, her glucose levels finally stabilized. It was like a crucial piece of the puzzle of my health finally fell into place, she described. I wasn't failing to control my diabetes. My body was fighting 2 problems at once. The immune system is another silent victim of obstructive sleep apnea. Chronic lack of quality sleep severely compromises the body's ability to fight infections and can even affect the effectiveness of vaccines. People with untreated sleep apnea often report getting sick more often and taking longer to recover from colds and other minor infections. Chronic inflammation caused by the repetitive cycles of hypoxia and reoxygenation during apnea episodes also contributes to the development of various autoimmune conditions and can accelerate the aging process throughout the body. It's as if your body is constantly in a state of inflammatory alert, never having the chance to calm down and repair itself properly. The safety risks associated with silent snoring are particularly concerning because they are often underestimated by both patients and their doctors. Excessive daytime sleepiness and decreased alertness can be fatal in situations that require constant attention, such as driving or operating machinery. Studies show that people with untreated sleep apnea are 7 times more likely to be involved in car accidents compared to the general population. What makes this even more dangerous is that many people with silent snoring don't realize how compromised their attention span is. They may feel alert enough to perform daily activities, but their ability to react quickly to unexpected situations is significantly diminished. It's like driving with dulled reflexes without realizing it. Now let's talk about something that offers real hope. The treatments available for silent snoring are highly effective when properly implemented, and many of the consequences we've discussed can be reversed or significantly improved with appropriate treatment. CPAP therapy remains the gold standard for treating obstructive sleep apnea, including cases of silent snoring. CPAP works by delivering continuous positive pressure through a mask, keeping the airway open throughout the night. For people with silent snoring, CPAP can be particularly transformative because they often had no idea how poor their sleep quality was until they experienced a truly restful night. Oral appliances which reposition the jaw and tongue to keep the airway open may be especially suitable for people with mild to moderate silent snoring. These devices are less intrusive than CPAP and can be an excellent option for people who travel frequently or who have difficulty adjusting to wearing masks while sleeping. Lifestyle changes also play a crucial role in treatment. Weight loss, when appropriate, can significantly reduce the severity of sleep apnea. Specific exercises to strengthen the muscles of the upper airway have shown promising results in recent studies. Even simple changes like sleeping on your side instead of your back can make a substantial difference for some people. Imagine a person who had given up hope of ever feeling mentally sharp again. After years of attributing her brain fog and fatigue to aging and stress, she finally discovered she had severe but silent obstructive sleep apnea. In the first few days of using CPAP, she noticed small improvements in energy, but it was the subtle changes over the following weeks that truly surprised her. "It was like a curtain had been lifted from my mind," she described. Conversations that had previously left me mentally exhausted now flowed naturally. Problems at work that seemed insurmountable suddenly had obvious solutions. It was like regaining a version of myself I thought I'd lost forever. For some people, surgery may be necessary to correct specific anatomical obstructions. Procedures to reduce excessive soft palate tissue, remove enlarged tonsils, or reposition maxillofacial structures can be highly effective when performed by experienced surgeons in appropriately selected cases. Positional therapy, which involves devices or techniques to keep a person sleeping in a side-lying position, can be surprisingly effective for people whose silent snoring is primarily positional. There are everything from sophisticated commercial devices to simple home solutions that can make a substantial difference in sleep quality. Treating silent snoring often requires a multidisciplinary approach, involving sleep specialists, dentists, specializing in sleep medicine, and sometimes surgeons. It's crucial to find professionals who understand that sleep apnea can be severe even when it doesn't produce loud snoring, and who take symptoms like brain fog and fatigue seriously even in the absence of obvious snoring. We've reached the end of this journey toward understanding silent snoring and its devastating effects on the brain, but I want to leave you with a message of hope and urgency. Everything we've discussed today, as daunting as it may have seemed, has real and effective solutions. Thousands of people around the world have already regained their mental clarity, energy, and quality of life through proper diagnosis and treatment of sleep apnea. If you identify with the symptoms we've described, recognize yourself in any of the stories I've shared, or simply have a hunch that something isn't right with your sleep, don't ignore these signs. Your brain may be sending you distress calls that you haven't yet learned to interpret. Each additional night without treatment can represent cumulative damage that will become more difficult to reverse over time. The first step is to talk to a healthcare professional about the possibility of a sleep study. Don't let the absence of loud snoring discourage you from seeking evaluation. Many cases of severe apnea are silent, and experienced professionals know exactly what to look for beyond the obvious signs. Remember that investing in the quality of your sleep is investing in every other area of your life. Your work, your relationships, your ability to enjoy experiences and create lasting memories all depend on a brain that receives adequate oxygenation throughout the night. You deserve to wake up rested, think clearly, and live with the energy and vitality that restful sleep can provide. If this video was helpful to you, please like and share it with others who might be experiencing the same challenges. Leave a comment telling me what you learned today or how you plan to use this information to improve your health. Your feedback not only helps me create better content, but can also inspire others to seek the help they need. Subscribe to the channel and turn on notifications so you don't miss our next videos. where we'll continue exploring topics related to sleep health and quality of life. I'm preparing content on the different types of sleep apnea treatments, how to choose the ideal CPAP device, and natural strategies that can complement medical treatment. Remember, your mind is your most precious asset, and protecting it starts with a good night's sleep. Don't wait any longer to investigate whether silent snoring is robbing you of your brain power. Treatment exists, it works, and it can give you back the full life you deserve.